Hello everyone, happy morning, a very good morning. Am I audible and visible? Yes, okay. So, everyone here, the how to join the quiz, the instructions are given there on the screen. You can see there on the right side of the screen, join my quiz. Go to the website, joinmyquiz.com. You can use your laptop, tablet, iPad, phone. If you'll need two devices basically. Okay? Give me a minute. So yeah, this is to start a day on a lighter note, a fun way. So basically, this is learn with fun, and extremely sorry for the delay because this is the first time that we are doing this. Actually, I've been conducting quizzes on this platform of quizzes since the beginning. Like when we started Telegram group, it has been our USP, and students really love it. There are some new features that are there in this now that we would be experimenting today, so do let me know towards the end, how did you find it if you would want. We will plan our sessions like this so that we learn with fun. After every question you answer, you will get the leaderboard, right? You will get the leaderboard, you'll get to see your preparation, where are you standing. So this today will serve like a pre-test sort of thing for ENT. A lot of mnemonics, the majority of the questions are on volatile topics, memory based. So mnemonics is where I would be helping you with in the today's class. Right, so we have approximately 15 to 16 questions that we have, all one liners, most important points in ENT that you must know. So your target, even if you have read ENT 1 year back, 2 years back, your target is to get all the questions right. Okay, everyone. So what I'll do is, when there will be the question which is projected, you won't be able to see me. And after each question, I'll come in again for the explanation as well. Okay, I'll come in again for the explanation. Okay. So everyone, let's start with this. I can see many of you have joined, a good number have joined. So let's start the quiz. All the best, everyone. And let's see who's there on the top of the leaderboard today. Right. So let's get ready for it. The plan for the day PTA topic, that would be covered in the today's 5 p.m. class. Apart from that, we have at an academy a free live class at 5 p.m. Where we will discuss ENT Rapid revision flashcards. All other important points which are not covered in this quiz will be covered in the 5 p.m. class. The link will be shared on Telegram and in this video's description as well. 9 p.m. we have KBMD session on Unacademy, the clinical questions fast 5. And today 10 p.m. we also have the counseling session. So since you are here, it's not meant for you. But for your seniors who are there, you can let them know that 10 p.m. we have, if they have any queries related to counseling, they can join in for that. Okay. So Harish, please see this joinmyquiz.com and enter the game code 292449. Please use the split screen or use two devices because side by side, you'll be seeing the YouTube screen as well for the explanations, as I said. तो एक स्क्रीन पे आपका क्विज चलता रहेगा और एक स्क्रीन पे आपका चलेगा the explanation, right? Okay, so here it goes, guys. Bye bye. Basically, because we are starting the quiz, I'll come in after every question with the explanation. Okay, so all the best, and here it goes. Let's start. everyone here. So who's leading? Tef Buchanan was leading at the end of the first question, right? So the question was, when a patient says the right uvula, okay, the right uvula presses the palate. Okay, so which of the following nerve is damaged? Okay, which of the following nerve is damaged? So when the patient is saying the right uvula is pressing the palate, that means the right side is going up. That means the right side is normal. It is getting elevated. So that means that the right side is normal. So it is the left side which is affected. So it is not the right side. It is the left side which is affected. Okay, it is the left side which is affected. Okay. Is this clear with everyone? We have seen the trick also to remember this. Everybody remembers the trick? What was the trick to remember? What was the trick to remember for our cranial nerve palsies that we had seen? Right, the trick was the rule of 17. Absolutely right. There was the rule of 17, right? There was the rule of 17. That is 10 plus 7 is equal to 17 and 12 plus 5 is equal to 17. If you remember out of this one, I find 12 very, very easy to remember. The 12 is easy to remember because cranial nerve 12, that is supplies the tongue muscles, and we know that the mnemonic to remember is tongue licks the wound, right? The tongue licks the wound. Tongue licks the wound means which side is damaged, at that side the tongue is deviated. So you will have the tongue deviated to the ipsilateral side. Okay, you will have the tongue deviated to the ipsilateral side. That means even in the fifth nerve palsy, the jaw deviation would be ipsilateral side. Okay, when the protrusion is happening, the deviation is to ipsilateral side. So for 10 and 7, it is going to be the opposite side. Okay, it's going to be the opposite side. So when I say if the right vagus is paralyzed, when the patient says अगर आप uvula का deviation देखोगे तो वो होगा opposite side पे deviation. ठीक है? So is this clear with everyone? Okay. Yes. So that is about this question. So remember 10 plus 7 and 12 plus 5. You will get the opposite side. When the patient says the elevation on which side it is happening, that is the normal side. Okay, that is the normal side. Okay. So yes, guys, I do understand because this is the first time. You would expect some difficulties using two screens, or the best way is to get another device. You have your family members right in the home. If you are in hostel, get your friend's phone, or you have an iPad and you have a phone. Use two devices, I would say. Okay, so first question, everybody is done with this one. Let's go to the next question. All the best, everyone. And here is the next question. So at the end of second question, koi Kale Khan hai who's leading. Okay, the Kale Khan is leading. I could see many of you answering incorrect as well. The correct answer here in Gradenigo syndrome, there is no vertigo which is seen. Okay, there's no vertigo which is seen in Gradenigo syndrome. Now, what is the trick to remember the Gradenigo syndrome? What is the mnemonic to remember the Gradenigo syndrome? Anyone? Remember, the mnemonic for Gradenigo syndrome is ear. Okay, the mnemonic to remember is ear. Okay, so yes, the question will come earlier than the YouTube screen, of course. That is why when I say ki going to the next question, look at the quizzes. Don't look at the YouTube screen. Okay, So Gradenigo syndrome, ear is the mnemonic. That means there is persistent ear discharge. Guys, the advantage with this discussion is that as I'm writing the mnemonics, you can keep taking the screenshots as well for your later revision. Okay, whatever you think is important that is being written on the screen, once it is done writing like on this whiteboard, you can take a screenshot and keep for revising later. Okay. A stands for abducent nerve palsy. That is the sixth nerve palsy. Okay. And R is basically your retroorbital pain. Okay. R is basically for retroorbital pain. इसका white board थोड़ा सा अजीब है, but उसके साथ सिर्फ थोड़ा सा adjust कर लेना. Maybe next time we will be better. ठीक है. So remember, ear discharge, abducent nerve palsy, and retroorbital pain. There is no vertigo in Gradenigos. Basically, it is the पेट्रस एपेसाइटिस. पेट्रस के अपेक्स पे जब हमारा CSOM, it's a complication that we see with CSOM. That is when you will see this triad. In a patient, you suspect Gradenigo's when even after the surgery for the ear, there is persistent ear discharge which is coming. That is the major clue to identify Gradenigo's. Okay, remember, it's very, very important. So remember, you have ear discharge, you have abducent nerve palsy, that is the sixth nerve palsy, and retroorbital pain. Okay, retroorbital pain. If you want, take a screenshot and keep for this mnemonic. अच्छा नहीं दिख रहा है, but you can write it down for yourself later on. Okay, so that was about the second question. Going to the next question, guys. Your eyes on the quizzes ka screen, not on YouTube, because YouTube pe the question will come later on. Okay, so going to the next question, I have started. So please see the quizzes screen. All right, Kale Khan maintaining the lead at the end of the third question, and 93 students have got this one right. Okay, 93 students have got this right. Let's go to the question here. What is Samter's triad related to? Okay, what is Samter's triad related to? So Samter's triad, all right, Samter's triad, remember the mnemonic for Samter's triad is up. Okay. So now wherever there is Sam coming, like we had the Somi brace in our yesterday class, here we have the Samter's triad. I'm sure that all of us think of the song Sami Sami, right? Sami Sami. So आप करते रहते हो Sami Sami, आप करते रहते हो Sami Sami all the time. So remember आप, okay, remember आप, that is basically your, what does that stand for up? It is asthma. Okay, it is asthma, aspirin sensitivity, and you have the polyps. Okay, asthma, aspirin sensitivity, and you have the polyps. That is what ARP stands for. Okay, that is what ARP stands for in Samter. So remember, it's related to the polyps, the ethmoidal polyps. A very, very important question. You get a clinical scenario as well. A patient with aspirin sensitivity, asthma, what would you expect in the findings? The ethmoidal polyps. Okay, the ethmoidal polyps. All right. So ye ho gaya ye question. Going to the next question, guys. Eyes on the quizzes screen. Rambutan read, maintaining the lead. Guys, what happened with this one? Only 57 students got this right. Many of you marked the answer as conductive hearing loss. Okay, many of you marked the answer as conductive hearing loss. See, Trotter's triad. Okay, the Trotter's triad. What is it seen in? Where is the Trotter's triad seen? Trotter's triad, remember, like the mnemonic here to remember, trotters is like throttling, okay, like throttling someone's throat, throttling someone's neck. So it is seen with nasopharyngeal carcinoma. Okay, remember neck se related nasopharynx. Remember you have nasopharyngeal carcinoma, andar kisi ne throttle kiya, and the mnemonic is NPC itself for your Trotter's triad. N for neuralgia. What neuralgia? The trigeminal neuralgia. Okay. Then you have the next one. Okay. What is the next one that we have? P stands for palatal palsy. Okay. P stands for palatal palsy and C stands for conductive hearing loss. Okay. C stands for conductive hearing loss. Is this clear with everyone? Remember the mnemonic for Trotter's triad. Okay. Remember the mnemonic for Trotter's triad, everyone. NPC. Okay, remember NPC. NPC, that is basically your nasopharyngeal carcinoma. Okay, nasopharyngeal carcinoma. I don't know why the whiteboard is not working again. चलो सबके लिए नया है, सीखेंगे, ठीक है. So it is your NPC. Remember that is neuralgia. You have palatal palsy and you have conductive hearing loss. Nasopharyngeal carcinoma will obstruct the eustachian tube and it will lead to conductive hearing loss, not to sensory neural hearing loss. Please remember that. It's a very, very important question. Okay, it's a very, very important question. All right. Clear with everyone? Okay. Let's go to the next question now. Okay, so next question, eyes on the screen of the quizzes app. Please go to the quizzes app and here it is. All right. Who's leading? Rambutan Reed is leading. What was the question? What was the question that we had? Just give me a minute. So the question is, following is true about Laryngomalacia except which of the following is not true about Laryngomalacia? Now, Laryngomalacia is a very, very important topic. Remember, Laryngomalacia means there is weakening of the larynx, okay, the cartilage there. It is very floppy one and that is why it folds on itself. You get the omega shaped epiglottis. It folds on itself. You get the omega shaped epiglottis. You don't need to do anything. Reassurance is the treatment of choice. Congenital laryngeal lesions, generally, they resolve spontaneously. We don't need to do aggressive surgical treatment because what happens with age is the cartilage will harden, the cartilage will thicken and the movement of the cartilage, of the floppy cartilage and causing the airway obstruction, that will decrease. The condition is noticed in the first few weeks of life, yes. And remember, it is not expiratory stridor, it is the inspiratory stridor. Always remember this point, okay? Always remember this point that inspiratory problem would be seen with the any problem above the trachea, okay? So larynx वगैरह के problems will lead to the inspiratory stridor. The more distal a lesion is located, like you have COPD, where your distal airways are affected, it is your expiratory problem. Okay, it's your expiratory problem. So in Laryngomalacia, when the baby inspires, the negative pressure causes the obstruction, the floppy epiglottis, that causes the obstruction. So remember, it is inspiratory stridor. It is not expiratory stridor. Okay, very, very important point. So everyone note down this point with every quiz, the question, the point that you are learning. Please note that down. Laryngomalacia, it is inspiratory stridor. It is not expiratory stridor. Reassurance is the treatment. Okay. So let's go to the next one now. Okay, let's go to the next question now. Okay, majority of the students got this one right. Following are the laboratory tests for diagnosis of vestibular function except which of the following is not a test. Please remember it is the Jelly's test, very very important. Yes, that Jelly's test is used for otosclerosis. Okay, the Jelly's test is used for otosclerosis. Give me a minute here to write down. So a very frequently asked question, Jelly's test is used for otosclerosis. And is the test negative or is the test positive? Okay, guys. So I understand that there's a lag from your feedback. I'll take that feedback because YouTube may always there's a lag. When I start speaking and when you hear, it's gonna come a bit late. So what I'll do after finishing the explanation, I'll wait for 5 seconds and then I'll start the question. Okay, then I'll start the question. Okay, that's what I'll do. So, otosclerosis, is it positive or it is negative? It is negative. Please remember the Jelly's test is negative. What do we do in the Jelly's test? Basically, external auditory canal, उसमें वो seagull speculum डाल के हम we increase the pressure, right? We increase the pressure. If it is sensory neural hearing loss or it is a normal patient, what do you see with Jelly's test? The hearing increases or the hearing decreases? What happens with the hearing if it is normal or SNHL? Now, when you increase the pressure that is transmitted to the labyrinth that decreases the movement of the hair cells, the hearing is decreased. In otosclerosis, the hearing is not decreased. That means it is negative and it is seen in otosclerosis. Now, otosclerosis is your conductive hearing loss, right? Otosclerosis is predominantly it's your conductive hearing loss. It is not your sensory neural hearing loss. So remember, it's not a test for vestibular dysfunction. It is basically for otosclerosis. Okay, otosclerosis is very, very important. Okay. Okay, all right. Aditya, feedback taken. Next question. I will not show you the poll screen. I understand it gives you a bias while answering. So I will not show that. Okay. All right, guys. So starting with the next question now. Okay, starting with the next question. Okay, so Rambutan maintaining the lead here, still maintaining the lead. Let's see who takes over this candidate. So 78, majority of you got this right. But remember guys, a very important question here. In a patient with CSOM, labyrinthine fistula, that's a complication. If you look at the anatomy, okay, if you look at the anatomy, what happens in that case is, okay, So you have the ear, right? You have the external auditory canal, tympanic membrane, middle ear, and then you have the inner ear. So the semicircular canal, which is in close relation here, okay, in close relation to the middle ear, the one which is immediately related, that is your lateral or the horizontal semicircular canal. Imagine you going horizontally. The first one that you will encounter when you go from outside inside is the horizontal or the lateral semicircular canal. That is the one which is also related to your facial nerve, right? So facial nerve palsy can also occur as a complication of CSOM. So remember, it's the lateral or the horizontal semicircular canal. Okay, very, very important. Now, going to the next question, I'll take 5 seconds because there's a lag. So before starting, so the next question here. All right, cauliflower ear is due to. So majority got this right. It is hematoma. Some of you got that wrong as well, right? Remember that cauliflower ear is due to hematoma. Okay, so just write down these all the important one-liners that you are learning in this quiz, because once you answer them in MCQs, you'll remember them better. So cauliflower ear is seen with hematoma. Imagine, you are carrying a cauliflower or someone throws a cauliflower on your ear. That will lead to hematoma. Okay, remember, it's not fungal infection, it's not a malignancy. It is basically hematoma. So seen with boxers, vagera. So that leads to the cauliflower ear. Imagine cauliflower, someone throwing on your ear, and that leads to hematoma. Okay, that leads to hematoma. All right. So that was about this question. Cauliflower ear is a hematoma. Let's go to the next question. Any queries, guys? I hope you are enjoying this. Yes, Ayush, thank you so much for understanding. Ayush, what I understanding here, the lag, I'll see, next time if I can decrease the lag, something I can do on that end, I'll definitely do that. Okay. Chalo, let's start with the next question. To get this right, okay, each one of you to get this right. On-Grens line passes from where to where? So what is the question here on on-Grens line? Okay, what's the question on on-Grens? What is the on-Grens line basically used for? To divide your suprastructure and the infrastructure, basically for your CA maxillary sinus. Okay, for CA maxillary sinus, to look at the prognosis. If there's a patient of CA maxillary sinus and the patient asks you whether the prognosis seems to be good or the prognosis seems to be bad. So we use this on-Grens line. So basically, which goes from the medial canthus to the angle of the mandible. Medial canthus to the angle of the mandible, right? So if the suprastructure is involved, okay, if the suprastructure is involved, that is the eyes, the skull, that means, of course, it's gonna be a bad prognosis. Okay, it's gonna be a bad prognosis. So that is what is your on-Grenz line for suprastructure and infrastructure. Remember, it is the medial canthus and the angle of mandible. Okay, it is the medial canthus and the angle of mandible. Clear with everyone? Okay, upper wala is bad, of course. So a quick thumbs up if the explanation is over at your end, so that I know ki I can start the next question. Passavans ridge. Okay, the question on the Passavans ridge. Passavans ridge, is it between superior constrictor palatopharyngeus, inferior constrictor palatopharyngeus, superior constrictor palatoglossus, inferior constrictor and palatoglossus? So look here, Passavans ridge. Okay, Passavans ridge is, remember, it is P and P. Okay, it is P and P, PP, all PP. So all PP, basically it stands for, let us see how many students got this right. 80 students. Many got confused between superior constrictor and palatoglossus as well, right? Many got confused in that. Give me a minute here. So basically remember that Passavans ridge, remember, it's all P and P. That means it is palatopharyngeus. It is not palatoglossus. It is palatopharyngeus. It is superior constrictor. ऊपर आता है palate. Right? Imagine yourself. Palate है. Palate जहाँ खत्म हो रहा है, superior constrictor आएगा, inferior constrictor नहीं आएगा. It is palatopharyngeus. Okay. So Passavans ridge is basically in the midline. You get the ridge-like thing because of the muscle fibers, superior constrictor and palatopharyngeus. Okay, very, very important to remember. So the next point to write down here in your notes basically is that Passavans ridge, okay, Passavans ridge is P and P. That means it is palatopharyngeus. It is superior constrictor. Okay, it is basically superior constrictor. So remember the P and P. All right. Starting with the next question now. Okay, starting with the next question. Regarding otosclerosis, all will be true except, so I want to see how many of you get this right. Okay, so this is an interesting one. This is an interesting one. I know that this will be a bit confusing, but very, very important to learn here is basically that 65 students. I knew that there would be a confusion between option C and option D. Now, here again, understand this question that otosclerosis, all will be true except Schwartz sign is seen. What is the Schwartz sign? The pink flamingo color that we see through the tympanic membrane. That is the Schwartz sign. Remember SC and SC. Okay, remember this. SC and SC. That is otosclerosis. You see the Schwartz sign. Okay, you see the Schwartz sign. Type AS tympanogram, there is sclerosis. AS, remember, it is sclerosis, right? So otosclerosis gives AS type of tympanogram. Is it low compliance or high compliance? It is basically low compliance. Okay, it is low compliance tympanogram. Now option C and option D, look at this one. Carhat's notch, yes, is seen. At 2K Hertz, yes, it is seen. But remember that it's not in the air conduction curve, it is in the bone conduction curve. Okay, that is what was the catch here. Okay, that is what was the catch here. It's not in the air conduction, it is in the bone conduction. It is at 2K hertz, that is your Carhartts. Now remember this Carhartts as auto and car. So auto and car, remember the two vehicles. So Carhartts car is seen in otosclerosis. Carhartts notch is seen in otosclerosis, and it is seen in bone conduction. Okay, remember bone conduction. So that was the answer here. Weber's lateralized to the ear with greater conductive loss. Yes, it is, because remember the easy mnemonic for the Weber's test is for Weber's. Remember C for S and S for C. That means in conductive hearing loss, the lateralization is to the same side. In sensory neural hearing loss, the lateralization is to the contralateral side. So suppose if I tell you that a patient has right SNHL, where will be the Weber's lateralizing? S is for opposite, S is for C, contralateral side. Okay, so right SNHL, it's gonna be to the opposite side. Weber's will be lateralized to the left. Okay, Weber's will be lateralized to the left. If it is right conductive hearing loss, C is for S, same side. Weber's will be lateralized to the right side. So in otosclerosis, bilateral, whichever has more conductive hearing loss, that side, because C is S, same side पे वो lateralize होगा. So remember that Weber's is lateralized to the same side in conductive hearing loss, and that is what the question says. Weber's lateralized to ear with greater conductive. Yes, that means the same side, the affected side, it would be lateralized. Is this clear with everyone? Understood the concept? So otosclerosis, what are the points that you need to write down for otosclerosis? Very, very important. It is conductive hearing loss. So Weber's will be lateralized to the same side. C is for S. Second, the sign that we saw, the Schwartz sign is seen, right? SC, otosclerosis. Auto is car. We see the Carhartts notch, but in the bone conduction curve at 2K hertz. And the next one we saw, Jelly's test is negative. ये हमने already देखा हुआ है पहले. Jelly is negative. And the next one, it is type AS tympanogram. Okay, it is type AS tympanogram. All these are the important points to be remembered. Very, very important. Okay, so just waiting for the lag, and then I'll start the next question for everyone. Okay, so going to the next question now, we have 5 more questions to go. Paranasal sinuses present at birth are which of the following? So another mnemonic to be remembered here, very, very important. All right, so let's see how many got this one right. Okay, so here we see 92 students have got this one right. Many of you answered the other options as well. Right. So what do we see here? The trick to remember paranasal sinuses present at birth. Okay, remember the trick for paranasal sinus present at birth. Who is present at birth? Someone who's born. If I am born, me is present at birth. Okay, me is present at birth. So I am present, that is me is present at birth. That means it is the maxillary sinus and the ethmoid sinus which is present at birth. Okay, remember this trick. Me is present at birth. That is maxillary and ethmoid is present at birth. That is what we need to know. Okay, that is what we need to know. So remember, there would be no frontal and no sphenoid sinus that we would see at birth. Maxillary and ethmoid would be present. Okay. So that was about this question. Going to the next one. Okay, let's go to the next one now. So we have 4 more questions to go. And quickly at the end with the flashcards, we will revise the questions. Okay. We will revise all the mnemonics quickly at the end. Right. Very interesting here. Incorrect match regarding the X-ray view. Am I audible now? Okay, am I audible now, everyone? I'm so sorry. I was so engrossed in telling you the story mnemonic that I did not see so many comments coming in. Ki there was no audio. So let me tell you what the story was basically. So imagine there is a town. Okay, there's a town which is a hilly town. Okay, there's a hilly town which is there. The town is below and you have the hills upper where you have the houses. Okay, so on the hills basically we have the houses. Now in front of each house for the water supply we have the well. Okay, start from drawing. अभी ठीक है, वापस से मैं drawing चालू करती हूँ, रुक जाओ. See, so basically you have a town here which is a hilly town. There are all the hills which are present here. The houses in this town are present over the hill. The houses are present over the hill. मतलब ऊपर की तरफ. नीचे की तरफ you have the main town which is basically the traveler spot. Okay, for a trip if you want to go, there's a garden there. There is shopping places. Everything is down in the town. Okay, town is down. Okay, town is down. In front of each house for the water supply, there is a well. Okay, in front of each house, there is a well. So basically what I want you to remember that town is present down. That means it is inferior orbital fissure. Well is present upper hill pe, that is superior orbital fissure. Where else is the well present? Well is present in front of the house. That means it is for the frontal sinus. So well basically here stands for card well. Okay, that is for card well. So remember card well view is for the superior orbital fissure and the frontal sinus. It is the best. Very, very frequently asked question. Cardwell is for the superior orbital fissure and it is for the frontal sinus. Town is down, inferior orbital fissure. There's the part 2 of the story as well, which connects the maxillary sinus with the Waters view, the Ricci's view for the optic canal. I'll tell you the rest of the story in the 5 p.m. class, because I have a drawing, a very beautiful drawing, so which will depict that and you would be able to remember it better. Okay? So at least remember, town is down, inferior orbital fissure, well is superior orbital fissure, well in front of the house. So Cardwell is for the frontal. Okay, Cardwell is for the frontal sinus. Okay. Now let's go to the next question, guys. Okay. चलो नेक्स्ट क्वेश्चन पे जाते हैं. The next question here, red line in pure tone audiometry is used for which of the following? So majority got this right, but few have got incorrect as well. Just remember the trick here. Okay, just remember the trick here, which is basically red line and the blue line. Okay, the red line and the blue line that we have. R is for R. Okay, R is for R. क्या हो रहा है इसको? Let me write down in this. It's better to write here. Okay. So remember that in the pure tone audiometry, R is for R. That means it is for the right side. Red color is for the right side. And for the left side, what do we have for the left? Remember, we have the blue color for the left. So remember the colors, the red and the blue, they indicate the side. For the air conduction, for the bone conduction, we have different markings, right? The circle, the lesser than, greater than wala. So remember, it is your red is for right side and blue is for left side. Okay, that is what you need to remember. As I said, the other mnemonics in pure tone audiometry again will be covered in the 5 p.m. class. Okay, the 5 p.m. class. So that was about this question, guys. How many questions more to go? We have 2 more questions to go. Okay, 2 more questions to go. And then we will quickly revise whatever we have learned in the next 5 minutes after this is over. We will quickly revise the 16 questions that we have had. Okay. Chalo, next question. Let's see the leaderboard. Who's there on the top of the leaderboard? Dil Dolores is leading still. We'll see the final leaderboard after one more question, right? We'll get the final leaderboard after one more question. This question again is something that you should not get wrong. Okay, this question is something that you should not get wrong. Okay. Which of the following laryngeal cartilages is hyaline? Epiglottis, corniculate, cricoid, or cuneiform? What was the easy trick to remember the types of cartilages? What is the mnemonic for the cartilage? The hyaline cartilage. Okay, the hyaline cartilage. The mnemonic is highline में अगर आप देखो, in itself you have inhale. Inhale is what is present in highline. If you rearrange the alphabets, inhale. So whatever is used in inhalation, the nose ka cartilage, the trachea, the larynx का cartilage, they would be highline. But कौन से cartilage highline है और कौन से elastic है? Elastic cartilage जो है, remember starting with E and ending in C. So epiglottis is elastic. C में your छोटा छोटा वाला cartilage are elastic. But जो बड़े cartilage हैं larynx के, जो thyroid and cricoid, which form the major, the skeletal framework, those are hyaline. Okay, remember those are hyaline. So thyroid and cricoid are hyaline. We know that if you look at an X-ray, you will see them that these are calcified. Hyaline cartilages, they calcify with age. You will see the thyroid and cricoid getting calcified. Okay, so remember that cricoid and thyroid and even your arytenoid, except for the apex. Okay, except for the apex. The end of arytenoid is elastic. Otherwise, the rest of that is hyaline. Okay, very, very important. So, इसमें आपको क्या याद करना है? Yes, very good, Payal. You can remember it with high cat. Okay, imagine this saying high cat. So, hyaline is cricoid, the bada cartilage. A is arytenoid, but except the ends, the apex of the arytenoid, and you have thyroid. Okay, and you have thyroid. So, these are the hyaline cartilages. Okay, these are the hyaline. Elastic का mnemonic है E or C वाला. So remember epiglottis has to move all the time. It cannot get calcified. It is elastic. E for elastic. Cuneiform, your cuneiform, corniculate, ends of arytenoid, these are elastic. Okay. Everyone clear with this? Abhi hum, you know what I'm planning. If there's a lag which is happening with the question that is coming, next time what we will do is, in the initial, suppose there are 10 questions, half a minute, 30 seconds, it will take just 5 minutes. So in the first half of the live session, that is the first 5 to 10 minutes, we will conduct the quiz at one go so that all of you would be able to see the questions together. There would be no lag. And once it is over, okay, then we can discuss the questions. Okay, once the quiz is over, we get the leaderboard and then we will discuss the questions. Does that sound better, guys? Or this is fine? One question and then the explanation. What do you think? What is inhale? Inhale basically stands for all the cartilages which are helping in inhalation. That is basically your nose, the larynx and the trachea. These are the hyaline cartilages. Okay, these are the hyaline cartilages. That's what Ayush said. We will do the quiz before the class and then we can discuss. Okay. All right. Chalo. Next question पे चलते हैं. Let's go to the next question. This is the last question that we have, right? This is the last question that we have. So turban epiglottis, who's the final year winner on the leaderboard? So someone has taken over finally at the end. So Mac is who I see leads. I'll show you the leaderboard also. Let's discuss this question. Turban epiglottis is seen in TB, leprosy, laryngeal papilloma, or is it seen with epiglottitis? Okay, is it seen with epiglottitis? So remember, the trick to remember turban epiglottis mein, the trick to remember is that, remember turban is T and B. Okay, it is T and B. So you can remember this as basically, just let's write down this as well so that for us to note down. This is a question asked in previous FMGE exam. Turban epiglottis, remember it is T and B. Okay, it is T and B. So it is seen in tuberculosis. Okay, so it is seen in tuberculosis. Two more left, Aditya, very good one. और रुको एक मिनट, 2 are left. I'll show you those questions also. Don't worry on that front. Let's go to the next question. Okay, let's go to the next question, because the next two questions are not your ENT related. It's basically your feedback related. Okay. So after that, we will quickly discuss all the 16 questions, the mnemonics basically that we have learned. So how did you find the new experience of the live quiz? Okay, so you have to write down how did you find it. So good, nice. Okay, that's great. I'll just do a bit change. As I said, let's try doing the quiz before all the questions together, and then we will discuss. Okay, maybe that is what we can also try and do. Let's see. Maza aa gaya Vidu. That's great. Amazing. Exciting. Interesting. Not good. Okay, okay, okay. So majority say good, and that's super awesome. So this was the first time we were conducting the live like this. We will keep doing the, few tweaks so that it's a good experience for each one of us. Okay, it's a good experience for each one of us. Okay. So thank you so much everyone for this. Ek final question hai. Amazing. First quiz, later discussion is what we will try the next time. Okay. So, final question here. Okay, the final question here. So, would you like to have, because that will give me an objective, that will give me an objective assessment basically. Yes, BJ Medical, I'll be answering your question. Just hold on. So more quizzes, majority say yes. That's super awesome. So we will keep doing it, as I said, with the tweaks, and that will help us, understand it better. The experience, let's refine on that. So let's have a look at the final leaderboard, guys. Who's leading? Sumac Spirit. Then we have Bamboo Barbie and Pitaya Fog. Congratulations, whoever they were. Who were there in the live chat? Do we have them? Aapka naam kya hai actually? So basically, if you see the toughest question, this gives us the quiz review. Only 27% questions were right correctly. I think there was the lag issue as well. Trotter's triad seemed to be the toughest question. Trotters, I hope you remember the mnemonic NPC, Gradenigos. And let's, as I said, so ye hai aapka leaderboard, guys. Okay, this is the leaderboard that we have. Just give me a minute. So Sumac Spirit, then we have Bamboo Barbie, and then we have Pitaya Fog. That is super, super awesome. Okay, that's super awesome. 94% accuracy, 88%, and then we have 83%. Okay. The time is also important here. Okay, the time is also important here. Quickly, let's revise this. So the first question, when the patient says the right uvula is pressing the palate. That means the right side is getting elevated. So it is the left side which is paralyzed. Remember 10 plus 7, it is opposite side. Next one, Gradenigo's syndrome. Ear was the mnemonic, right? E, ear discharge, abducent palsy, retroorbital pain. We don't have vertigo. Next one, Samter's triad, Sami, aap karte ho, aap, asthma, aspirin sensitivity, and polyps. So it is related to the polyps. Trotter's triad, remember NPC, C for conductive hearing loss. It is not your sensory neural hearing loss. It's seen in NPC, that is your nasopharyngeal carcinoma. Laryngomalacia, important point, the stridor is an inspiration. It's not an expiration. Okay. उसके बाद में जो next है laboratory test. Jelly's test is not for the vestibular apparatus. Jelly's test, otosclerosis negative. Next question, CSOM, labyrinthine fistula, most common is lateral, that is the horizontal. When you'll go in direct, you will be hitting the lateral one. Next, cauliflower ear, only 38% got this right. Cauliflower, someone throwing on your ear leading to hematoma, right? खून जमा हो जाएगा, hematoma होगा. Boxing, right? Boxer's ear. On-Gren's line, medial canthus to the angle of the mandible. It is not to the mastoid. It is to the angle of the mandible, suprastructure, infrastructure. Okay. Passavant's ridge, remember PP, palatopharyngeus, and it is S, that is superior constrictor. So remember the P and the S, that is palatopharyngeus and superior constrictor. Otosclerosis, Otto is car, Carhat's notch at 2000 in the bone conduction, not in the air conduction. Schwartz sign, CSC is Schwartz sign. Then you have your, the next one, Weber's, to the conductive side it will be there, and the AS type of tympanogram. Paranasal sign is present at birth, me is present, maxillary and ethmoid is present. Incorrect match regarding X-ray view. Down is down, that is inferior orbital fissure. Well is present, superior orbital fissure. House in front, well in front, that is your frontal sinus. Rest of the story to be continued in 5 p.m. Red line, R for R, it is the right ear. It is not for bone conduction, air conduction. For the left, L, blue, R, red. Right is red. Which of the following cartilage is hyaline? Remember, high cat. That is your cricoid, arytenoid and thyroid, except the ends of the arytenoid. Ends, E for elastic. Okay. Remember, epiglottis, E for elastic. Epiglottis is elastic. Okay. Turban epiglottis, TB. Okay. Turban epiglottis is TB. And then we had the review questions, right? So these were the questions. All of them were one-liners, fact-based, mnemonics-based. So I've tried to cover it here. The rest of it with the flashcards, you know, the important points, we will cover in the 5 p.m. Unacademy free class. You have 2 classes more for today, not 2, rather 3 we have. 5 p.m., 9 p.m. and 10 p.m. 5 p.m. is ENT class, free. 9 p.m. is a KBMD, fast 5 KBMD, clinical mixed bag questions, not had since a long time. 10 p.m. is for the students who are attending counseling and have some queries. You can, they can come for that class. All these are on the Unacademy app. Okay, all these are on the Unacademy app. So this is the plan that we have for the rest of the day. And all of these are free classes. Okay, all of these are free classes. Amazing. Samvarth got 4th and hyaline cartilage, Matan, hyaline is high cat, cricoid, arytenoid and thyroid. Okay, arytenoid के ends नहीं है but. Must do things for each day target, as I said, BJ Medical has that query. जो PDF है Telegram group पे, okay, if you want I'll show you कि कहाँ पे मिलेगा वो आपको PDF. Go to the channel, my channel Dr. Nikita Nanwani, search in the files for previous, okay. So you will get this previous year NEET PG वाला topics का PDF. ये PDF में once you go to this PDF for every day's target, okay, every day's target, like it's ENT. ENT में जाओ, कहाँ गया ENT, इसके नीचे आएगा शायद. Let's wait for this. हाँ, so this one that you have ENT, जो भी topics यहाँ mentioned है ना, on both the columns, you will find some topics missing here, some extra topics here, or the vice versa. So the 2 columns are to give you an overall, from both the resources. अगर एक आधा टॉपिक यहाँ मिस हो गया तो यहाँ दिख जाएगा. तो यहाँ पे जो भी टॉपिक्स मेंशन है, ईयर में इतने टॉपिक्स हैं, नोज में इतने टॉपिक्स हैं, फेरिंग्स, लैरिंग्स, सबसे पहले आपको करना है ये वाले टॉपिक्स फिनिश करने हैं, ऑल ऑफ देम. Then solve the PYTs, okay, solve the PYQs and see whether you were able to answer all of them. So what I would do if I was in your place, first read all these topics, then solve the PYQs like a test and see how much I'm scoring. Any question which I do wrong in PYQs, I will read that topic again. Okay, at least this is the bare minimum that I would do in the revision cycle. Apart from that, I know my weaknesses, you know your weaknesses, कि मुझे ये subject में ये topic weak लगता है, वो आप revise कर लेना, ठीक है? That is what you should be doing. So that was a podcast. The open house is on 4th. It is tomorrow. Okay, it is tomorrow. All right. So yes. What will we do? We'll meet at 5 p.m. We'll try and conduct other quizzes and let's see how it works. The quiz first, and then we will have the discussion part of it. Okay, the quiz and the discussion, that is what we will have. So I think we've had the free test for ENT already today, guys. With the quiz, directly we will have the post test tonight. Okay, we'll have the post test tonight on the Telegram group. Okay. So thank you so much everyone for joining in. I hope you have enjoyed this, the new experience basically. And I'll see you again at 5 p.m. on the Unacademy app. Till then, good.